I think tele consultation and online consultation is something which will become more and more important in future, especially in pediatrics. I've been in this field for now more than 15 years, and communication has always been a big problem. Of course, it became better once the mobile phone started, but then it's in a way it's a blessing, but it has also been very stressful for us in the last few years because we have patients constantly calling on the mobile, and time is precious, and sometimes it's very disturbing when patients call at odd times. And after using teleconsultation, I think it has become more streamlined, and that is what we have always wanted. We want to extend this facility to the patient. We want to be available for them at all times, especially in times of emergency. But we would like them to use it judiciously, and also keeping in mind that respecting the doctor's privacy and using it when it's absolutely necessary. As a pediatrician, we not only do offer outpatient services, but we are also attached to several places because we have to be available when the baby is born, be it a normal delivery or a C-section. And that is the reason why we are not always there at one place. And we also need to go and see the babies at different locations. And it becomes a little difficult for the patient when we are not available at the same place all the time. With a single number facility, the patient is able to stay in touch with us wherever we go, and also able to access different hospitals where we are visiting consultants without actually having to dial that particular number. So the single number access is of great use, I feel. And all they need to do is to store one number on their mobile, and they are able to even talk to me even when they are traveling or if they are anywhere, and they can easily inquire at different places where I visit whether I will be coming and what time I will be consulting. So I think it's very convenient. Point number one, the stress factor has been reduced quite a lot. Two reasons for that. One, when the patient pays for a service or pays for a facility, they become more conscious of that fact and do not call us for trivial reasons. So they use it for emergencies and also use it as a follow-up. So that way it is very good. And second, of course, it is something which is under our control. So we can specify the time when the patient can call us. So in case we don't want to be disturbed, it is possible to specify the time, but I have decided to be available 24 hours because in pediatrics, we often have emergencies at night and parents become very frantic. And since we are the people who have been taking care of the baby from the beginning, and if there's any emergency, they would like to get in touch with us, and it becomes easy for us to guide them. So without actually having to go to the hospital and see the patient, we can direct them to the right place. Yeah, I think one point remains the same for patients when they come for consultation, and this is very useful as a follow-up tool because if we have a child, for example, with fever who is not getting better after 72 hours, the parent is always in a dilemma whether actually to come and consult me or just call up and ask. So teleconsultation becomes very useful there because they can call up and I can ask a few questions which help me to decide whether I actually need to see the baby or I can afford to wait for another 48 hours. So for the patient, it saves the trouble of having to come and see me again if there's no requirement. So that is of great use to the patient, and they are of course happy because I'm available all the time, and they know that once easily. And also the important thing here is that, because it's a specific number, so when somebody calls me on my cell, I know it's a patient who is calling. So I'm able to identify the patient. And so I will, as far as possible, definitely pick up the call. I would say most of it is good. Whenever we introduce a new facility, there's always a mixed reaction. There are people who, feel that it is of use. Fortunately for me, at least I would say 80% of my patients who have been very happy when I have started. And in fact, when I messaged everybody that this kind of facility is going to be available at my clinic, I had people calling up and asking, and the next time they came for consultation, they asked for it. They said, do you have the telecard? And can I have it? There have been a few patients because they have been using this facility without having to pay for it for a long time. So they feel that, that it should be given as part of service from my part without charging for it. But I have tried to explain to them that this is not only from the monetary point of view, but it's more to make sure that the patient is careful while calling and doesn't call me up for trivial reasons like, whether I can feed Cerelac to my baby at 11 o'clock in the night. So that's where I think, the patients have to become aware that they can use a facility if it is required and in times of emergency. I am dealing with patients who live in urban areas, and most of the young parents, they are working parents, and I think barely 2 to 3 months after the baby is born, the mother has to get back to office. So, and we get patients from all over the city. Commuting is a big hassle now. So the thing is, if I am readily accessible on the phone, so through teleconsultation, they are able to at least call me and consult me if they are not able to come, and I can guide them until they find time to visit the clinic. So that way it's a big help, I think.
Your work-life balance perspective?
For me, definitely I feel in the last 6 months my stress has reduced because I'm able to identify that it's a patient calling. So otherwise, like anytime I was driving or if I was in the OT, I would always wonder who is this person who has called me. So now, because I'm able to identify that it's a patient, and I have also given instructions that in case I don't pick up the phone, it's probably because I'm busy doing something. So they always call back. I think it's very simple once they get the hang of it. The only problem has come from patients in terms of, charging the card online. There have been a few patients who say, I don't have a credit card, I never use the internet. So tell me of a different, a different solution, an alternative as to how I can charge the card. That the patients have been used to talking to me, all the time without having to think of, having to pay for it. And that was, the transition was a little difficult because the parents had to understand. So it took some time for them to understand the reason why I was doing all this. But at the same time, they were very happy because, as doctors, we are not very comfortable with technology and we haven't used it, effectively, I would say, all these years. So now I think this is high time because it is beneficial. So that was the challenge because I had to, understand that this is something which is going to be the future. Now that they know that it's only one time that they have to remember the card number and the telephone line, it's become very convenient. Now, if they had to take a card every time, it became a little difficult because they would just throw the card or, like they say, oh, we have lost it, so give me another one. So that, we were not able to streamline that. But after the system of charging it online has started, I think it's pretty convenient for them. So I don't problem. I think as far as medicine is concerned, and especially pediatrics, I think more and more people should try to use this facility, especially in urban areas, because like we have discussed before, it's very difficult for parents to come rushing when they are busy at work. So this is something like a middle path where they can talk to us and at least have the assurance that yes, the child is not that sick, so they can afford to wait and then come back when they have time. The first step would be to be open-minded towards technology and new things which are coming up, and understand that it is going to benefit them also, as well as their patients. So I think they should definitely try it out, and they should, I think, also learn to respect their own time and privacy. And if